Yes, my name is Alayne Hodges. I'm here today to tell my story, my experience here at CHRISTUS Heart Hospital. When I came to Tyler, which was in August of 2020, I started a job and noticed that I was so lethargic. I was so tired. I would walk from one end of the hall to the other. What normally was not an issue, I was exhausted by the time I got to the other end of the hallway. And I knew something was going on, something was wrong. I had been on cardiac medications for a long time, and I knew I was taking all of those, but something was different. I listened to my body, and that's what you need to do. Listen to your symptoms.
When she came into my clinic, I was also concerned. There were some abnormalities on her EKG, and that with her risk factors and her symptoms prompted us to do some further testing. The symptoms kept persisting, and the next step was to get her checked out with a coronary angiogram. We were able to do that here with a non-invasive test called a coronary CTA, or it's a CAT scan, where you inject dye and you can assess for blockages. And that's really what led us to moving forward with more aggressive workup.
I had spoken to Dr. Turner at length about my options and what I needed.
Well, that is a coronary artery bypass operation. If the patient has blockages in the proximal portions of their arteries, the very first part, those are good candidates because you've got areas where you can go around those blockages. You can have targets, so to speak, to put the grafts. And what that does is restore the blood supply to the areas of the heart or the muscle that are in jeopardy.
And so I checked in at 2 o'clock so that I can do all the pre-op before the next morning is when I was having surgery. And then first thing, they were ready for me to go in. And nurses were amazing getting me ready for that surgery. It was a major surgery. It was major recovery. It took a lot of rehab, took a lot of visiting with my physicians. They were so attentive. They're such good listeners. They lead with their talents and their expertise and with their compassion. I couldn't have asked for a better situation.
Usually when somebody tells you something is wrong, something's wrong. And if a patient tells you that they feel bad or they're having chest pain, you need to listen to them. And we take that very seriously.
I'm just really grateful that Alayne listened to her body and sought medical attention, even though she didn't have typical elephant sitting on the chest, coronary signs. I think that can be, that can escape some people, and I'm really grateful when people are able to listen to their bodies.
5 years post-op, I have a granddaughter, a 2-year-old granddaughter who I take care of a lot. I'm very active. I try to walk as much as I can for exercise, try to eat heart healthy, just try to be happy and enjoy life. I feel like I had a second chance.